Well, good evening, everybody, and thank you for joining me for my last webinar with you. I can't believe this is the last one. I think it's number 6 that I've been doing with you over the last couple of months. And I'm kind of happy that this is the topic for our last webinar because it's such a common problem in feline medicine. We all see these cases of cats with vomiting and diarrhea. And tonight, we're going to concentrate on the chronic vomiting and diarrhea cases, mainly because we see so many of those cases in feline medicine, and they can be quite difficult to solve. So we won't so much be talking about specific diseases, more we'll be talking about what is our approach to working up these clinical problems, what are our differential diagnoses, what tests could we use, what are they best suited for, and so on. So we'll talk initially about our first approach to these patients, the basic things that we need to do for these patients. And we'll talk about the different differential diagnoses for chronic vomiting and diarrhea. And we can talk about those two clinical problems together because so many cats have both. And so many underlying problems cause both vomiting and diarrhea. There'll be a couple of points where I'll separate out vomiting versus diarrhea as we go through the discussion tonight. And then we'll look through the various diagnostic tests that we have and what the pros and cons or the best uses are. And then we'll touch a little bit, especially on some general therapeutics and some general guidelines, especially around using things like antibiotics. So that's our outline for tonight. And before we get started and get into the heart of this discussion, I do want to thank our sponsor tonight, which is Zoetis, for so kindly supporting the webinar for us tonight. My thanks go to Zoetis for doing that. So a very general approach to vomiting and diarrhea, in my mind anyway, is divided by whether my patient has acute onset of clinical signs or whether it's a chronic problem. And tonight we're going to be talking primarily about the chronic problems. The acute cases are very often self-limiting. Very often they're easy to manage with just symptomatic and some supportive therapy, maybe some drugs for vomiting or fluid therapy, for example, if they're dehydrated. We always, especially in younger cats or cats with outdoor access, we always think about parasites. And for diarrhea cases particularly, we might go ahead and use a broad spectrum dewormer routinely in these diarrhea cases. I guess the one rule of thumb I would give you for these, especially these acute cases, would be to avoid corticosteroids. And in fact, even as we talk about the chronic cases, that's where corticosteroids often come into play for diagnoses like inflammatory bowel disease, for example. But we'd like to have a specific diagnosis before we go ahead and start corticosteroids so that we're not using them inappropriately in a patient. So especially in the acute patient, I don't think corticosteroids play a role. They will play a role in chronic disease, but again, preferably with the diagnosis. So those are the acute cases. The chronic cases are what we're going to talk about tonight. And what makes the transition from acute to chronic? Well, there isn't really a standard definition of what a chronic diarrhea or chronic vomiting case is. But I would say any cat that has had clinical signs for, let's say, about 2 weeks or more without an improvement, without you seeing some progress in that patient. So certainly once we get to the 2-week point and counting, then I think we've got a chronic case, whether it's vomiting or diarrhea or both. And then we have to use a little bit of a different approach. So if we haven't done some of those initial diagnostics, like a minimum database, which we'll talk about in a minute, then that's where we start to do some of those things. And then we're going to go through some of the more specific or advanced tests. We'll talk about imaging, gastrointestinal function tests. We'll talk about what biopsies might do for us, and then we'll talk a little bit about our therapeutic approaches for these as well. The one thing I did want to say about the acute vomiting cases before we move on and just talk about the chronic cases is that in the past, it was more common for us to recommend withholding food for maybe 12, 24 hours, something like that, in an acutely vomiting cat. And now, current recommendations would suggest that we don't do that. That may be true in canine medicine as well. So my expertise is with the cat, so I can only really speak to the cat. But we really don't want to recommend withholding food in acute cases any longer unless the vomiting is so intractable that we need to get control of it first before we feed the patient. So with the exclusion of severely ill patients that you might not want to eat, maybe because you think they're going to need surgery imminently, something like that. We don't routinely withhold food from acutely vomiting patients. We now know there's more benefits to continued feeding, and there's more potential adverse effects. So we're more likely to see adverse effects on the gastrointestinal mucosa, for example, ulceration, translocation of bacteria across the intestinal mucosa in patients that have been fasting. So I would say fasting is no longer a general recommendation in the acute patient. I would reserve it for the very specific patients where, for example, again, vomiting is intractable, you think they might have a perforation, you think they might be headed to surgery, something like that. Okay, so that's really all I wanted to say about acute vomiting, and we're going to focus now on the chronic vomiting patient. But before we do that, I just want to talk a little bit about what our general approach is to clinical problems, especially in cases like this where we have, as we'll see in a moment, a huge differential diagnosis list. So I just want to remind you that you do need to have a game plan. You need to have an approach that you're going to use whenever we work with a very generic set of clinical signs like this. And so there's really two traditional ways that clinicians, whether you're human or veterinary, approach working up clinical problems. And one is called the problem-solving approach. And in the problem-solving approach, your goal is to make a list of differential diagnoses, and then by looking at your patient, start ruling in or ruling out with the use of diagnostic tests so that you start to refine that list. So for something like vomiting and diarrhea, we're going to have a huge differential diagnosis list. So we need to refine that down. And to some degree, we're going to use our patient signalment to exclude some of those potential diagnoses. And then we're going to start using diagnostic tests. So that's called the problem-solving approach. The other approach is called the pattern recognition approach. And in this approach, you don't so much work with a list of differential diagnoses, but you're looking at patterns based on your patient, the age of your patient, for example, maybe the breed, maybe the medical history. You're looking at the clinical findings. And we all do this every day. It's a type of intuition in a way, where we look at a patient and we just say, I know based on that patient, here's the number one thing I think they might have, or the top three things. So instead of starting with a huge differential diagnosis list, you immediately go, okay, based on what I see in this patient, here's a couple of things that I think rise to the top of the list. And in reality, I would tell you that the best approach is combining the two. And the reason I say that is if you make sure that you always have a large differential diagnosis list, it makes sure that you won't forget something. So one of the downfalls of the pattern recognition approach is that we might prematurely focus in on something based on what we see in our patient or based on our past experience, and forget about another differential diagnosis. And it might take us a longer time to come to the correct diagnosis. And of course, the downside of using just the problem-solving approach is that you start with a really huge list of differential diagnoses, like we will for this clinical problem. So that's why it's best to make sure you do have that list, but you start off your approach using pattern recognition layered on top of that huge list of differential diagnoses so that you can begin to refine it down. but you still have that larger list on hand in case your initial investigations are not leading you to a diagnosis. So that's why I say I think the best approach for these very generic sets of clinical signs is to use both pattern recognition and the problem-solving approach to your patient. So with that in mind, what we're going to do now is look at a list of differential diagnoses. And I've put this list in your notes. So I've actually provided you with a lot of materials for tonight's topic. So you'll see that there's a set of notes on vomiting, there's a set on diarrhea, there's a set on inflammatory bowel disease, and there's some additional other supporting materials in there because it is such a big topic. So you will find a list of differentials for chronic vomiting. So for both vomiting and diarrhea, when I'm looking at that list of differential diagnoses, and this is just a generic list for cats that you can keep on hand. You don't have to build this list every time. So this large list is something that probably you should just have on hand so that you can refer to it whenever you have one of these patients. And so I divide this list into non-gastrointestinal versus gastrointestinal problems that will cause chronic vomiting in cats. So there's a lot of non-gastrointestinal problems, so a lot of metabolic diseases. So we had a webinar a few weeks ago on chronic kidney disease. That's a cause of chronic vomiting in cats. A lot of endocrine diseases like diabetes or other hepatic diseases, urethral obstruction, electrolyte problems, heartworm infection. One of the common clinical signs of heartworm infection in cats is actually vomiting. So there's quite a long list in addition to toxin exposures, side effects of drugs. We don't see as many neurologic causes of vomiting in cats, but probably under that umbrella would fall something like stress or motion sickness, for example, in addition to organic neurologic disease. So there's a long list of potential causes of chronic vomiting that are outside of the gastrointestinal tract. And so we need to be cognizant of that list. So it's worthwhile to keep a list like that on hand. And then, of course, there are some specific gastrointestinal diseases that will cause chronic vomiting. Infectious diseases, some of the viral or parasitic diseases or bacterial, a little bit less common in cats to see bacterial causes. Obstructive diseases like foreign bodies, for example, in cats, or an intussusception, neoplastic conditions, whether they're more solid tumors like adenocarcinomas or more sometimes lymphomas are often very diffuse. Inflammatory diseases, and of course inflammatory bowel disease would be the number one there. And then dietary causes, so anything that causes what we now call food responsive enteropathy. So that covers a true food allergy, which is an immunologic reaction, as well as intolerances to components of diets which are not immunologic. So that all falls under the umbrella of food responsive disease. So those would be some of the more gastrointestinal focused causes of chronic vomiting. And so just for the vomiting component alone, we've got a pretty big list to work through. And then, of course, if we want to look at the diarrhea list, because a lot of your patients will have chronic vomiting and diarrhea together. So, but I separated them out. So again, I look at the extraintestinal causes for chronic diarrhea. So it could be disease in another organ like the pancreatic diseases that we sometimes see in cats, like pancreatitis or exocrine pancreatic insufficiency. That one often gets overlooked as a cause of diarrhea. In cats, we think of that as a dog disease, but we now know that cats get it too. Hyperthyroidism, there's a cause of chronic diarrhea, sometimes vomiting too, but more often chronic diarrhea in cats. And then environmental factors, and that's again where things like stressors. So cats can get both vomiting and diarrhea from living in a stressful environment. That can be part of their stress response. So that's the list of potential differentials that are extraintestinal. And then, of course, just as for vomiting, there will be gastrointestinal causes as well. And a lot of these are the same infectious ones, parasitic ones, inflammatory bowel disease again, neoplasia again. And we do sometimes see diarrhea as a consequence of partial obstructions in cats. So we're a little bit more likely to see vomiting with things like foreign bodies and intussusceptions, but we can sometimes see diarrhea too, especially if it's a partial obstruction. And also remember that masses that are within the abdomen can also put pressure, can put compression on the gastrointestinal tract. So I do want to point out, I've mentioned foreign body a couple of times, and you might think that would fall more under the category of acute vomiting or acute diarrhea, but we actually do sometimes see cats with chronic foreign bodies. So I would never, in a cat, rule out a foreign body based on how long the cat has had the clinical signs. So there's some, even in the literature, there's some well-documented cases of cats having chronic foreign bodies, and then eventually they were discovered and removed, and the gastrointestinal signs resolved in those patients. So that's why I have things like obstructions, like intussusceptions, and of course we know intussusceptions can be intermittent as well. So we can see chronic signs from these obstructive or partial obstructive diseases in cats as well. So having had that look at our differential diagnoses and that big list, then we're going to start looking at what it will be our initial approach to these chronic patients with gastrointestinal signs. So again, we're talking about patients that have had their clinical signs for, let's say, at least 2 weeks. So of course we want a good medical history on these patients. It's very important to get a thorough physical exam. We're going to talk about each of these a little bit more in depth. There are a couple of key assessments that I like to have on these patients. A nutritional assessment, of course, because dietary factors can be a cause of both vomiting and diarrhea. And we've already alluded to the fact that as part of their stress response, some cats will have vomiting or diarrhea. So we need to think about the environment that they're living in as well. So we'll look at each of these in a little bit more depth. So when we're taking our medical history, there are some general things that we need to ask about. So how long has the problem been going on? And again, once it's 2 weeks or more, we really need to be very diagnostically focused for these patients. A history, again, of things like their diet, the environment they're living in, of course, age, breed, and so on matter. But when we're talking about vomiting and diarrhea, we'll also want to know some more specific things about what's going on with the process of vomiting. We want to make sure we're distinguishing vomiting from regurgitation. We don't see regurgitation as often in the cat as in the dog, but you still want to be sure that it is truly vomiting that you're seeing. And sometimes owners will say to you, my cat is regurgitating their food, and so I wouldn't take their word that it truly is regurgitating. They might not understand the correct definition of that term. So we always want to be sure that what is the actual process. What are they vomiting? What's in the vomitus, and so on. And of course, are there any other changes going on in that animal? So we have a lot of generic things to ask about. I do like to use this short diet history form from the World Small Animal Vet Association. This is the form that we use in my practice to get a dietary history. And I may have mentioned this to you before in some of the previous webinars that I've done, that we try to get owners to fill this out before they come into the clinic so that they have time and they can give us detailed answers to the questions. So if you don't have, this is just a one-page diet history form. If you don't have a short one that you're using with your owners, and this would be both canine and feline, then you can look at the one at the World Small Animal Vet Association website, because they have a free downloadable one that you can use. So that will help you with the diet history component of our assessment. And the other assessment that I mentioned was the environmental assessment. And so in the materials that I provided for this webinar, I put this form. So this is from Ohio State University, and it's part of what they recommend for an environmental assessment. So they call it the Indoor Cat Home Checklist. And it's really just asking the owner things about the home environment that will help you understand if there's a stress component to either the clinical signs that your patient is having, or we also use this in cats where there's behavior problems and we're trying to figure out what is the cause of the behavior problem. So again, this is it's a pretty quick, easy for owners to fill out. It doesn't take very long, but we do like owners to fill it out at home, so they're not doing it in a rush while they're waiting in the vet practice. So you will find a copy of this in your materials that you can download. If you go to the Indoor Pet website, if you haven't seen that yet, the Ohio State website, they have a lot of additional information there on a healthy indoor environment, the stress component to diseases in cats, because it contributes to a number of diseases in cats, not just gastrointestinal disease. And then a lot of resources there, both for you and for owners. So if you haven't been to that website, I'd highly recommend that you have a look at it. Okay, so for vomiting and diarrhea, there are some very specific questions that we want to ask as we start to focus on the reason why the cat has come to us. So we want to ask things like, has this happened before? Was there a diagnosis before? You know, maybe at a different veterinary clinic, the patient was already diagnosed with another disease. That might help us in interpreting the current clinical signs. Of course, how long have they been going on? What is the quality of the cat's appetite? Is the cat still eating? Often owners don't notice that cats haven't been eating well for a while, so it's sometimes hard to get very specific information on that. Of course, we want to know about deworming history, vaccination history, and then again, what is the home environment like? So we'll use that environment questionnaire that I showed you, but we also want to ask about other pets in the home. Have any other pets had similar clinical signs or been diagnosed with a disease that might help us understand what's going on with this particular patient? So we want to start with the general and then start to focus in on the specific problems. So the owner might bring the pet in just for vomiting or just for diarrhea, but we always want to ask, maybe there is some of the other clinical sign going on as well. So is it just vomiting? Is it just diarrhea? Or is there both? So if we just have vomiting, we might only narrow in on causes of chronic vomiting and leave out the causes of chronic diarrhea, although again, there is a lot of overlap. So we'll want to get information from the owner, like how long has the vomiting been going on and what's the frequency? Is it every day? Is it multiple times a day? What are they vomiting? Is it hair? Is it food? Is it pieces of a foreign body? So they chew and swallow something. With the diarrhea, again, the frequency, the quantity. So is it a large amount, a small amount? What's the appearance? Is there blood? So, for example, you can see there's a little bit of blood in this photo. And in fact, I'll often ask owners to bring me photos. If the cat uses a litter tray indoors, for example, I'll ask them to bring me photos like that, because I can often get more information from looking at a photo than I can from having the owner try to describe it. Owners often have a difficulty describing it. And so one of the reasons we want to have a really good description for diarrhea is because we always want to try to figure out, is this patient having large bowel or small bowel diarrhea? And so we need to know about things like, is there mucus present or blood present? What's the volume? What's the frequency? Things like that. So that can help us narrow down our differential diagnosis list, especially for cats, because there's fewer causes of purely large bowel diarrhea in the cat than small bowel diarrhea. So you'll have a shorter differential diagnosis list if you can confirm that your patient has large bowel diarrhea. A lot of time in cats, it's small bowel diarrhea or it's mixed. So that still leaves us with a large set of differential diagnoses, but it still can be useful to know some of these characteristics. So one of the other things that we do to help us get more information about the character of the diarrhea is to use a fecal scoring system. So all of the pet nutrition companies have one. I like this one from Purina. So you can get it from Purina. This is actually a little older version. They have a newer one they use now. But this is the one that I like to use in my practice. Each company has their own scoring system. So this is a score from 1 to 7. They're not standardized, so every company's one is different. But I like this one because the pictures are so good. You want to have very realistic pictures. So we show this to owners and ask them to show us which of the examples on this chart, which of these most resembles what they see at home. And for most cats, something between a score of 2 or 3 is normal. Something in between here, 2 to 3, is normal for most cats. So this is too dry and hard. We've probably got a very dehydrated cat. And these are all examples of diarrhea. So the other reason that using pictures is helpful is most owners would say that score 7 is diarrhea. That obviously looks like diarrhea. But this, score 4, is diarrhea too. And not everybody would call that diarrhea. So that's why it's really useful to show them pictures. So I'd recommend that you have a copy. We made a laminated copy that we use in our exam room, and we show this to owners. So again, you can get them, I think, from all of the nutrition companies. You can probably download them online as well. But this happens to be my favorite one because I think the images on it are so good. So that helps us gather the type of information that we want in our history. So let's talk a little bit more now about the physical exam. So when we have the chronic vomiting and diarrhea patient, certainly we want to do a good, thorough physical exam, but we'll want to be very sure that we focus in on some key things. So does the patient have a fever? That might make us think more of a bacterial involvement, whether it's a primary bacterial disease or the patient, for example, has a foreign body or a perforation. For example, is there weight loss? That might make us think more of non-GI sometimes diseases, or severe inflammatory bowel disease can give us weight loss, for example. Is our patient dehydrated? What's the color of the mucous membranes? Is there pallor or paleness to the mucous membranes? Do we find any effusions or edema that would go along with hypoproteinemia and might make us think of a protein-losing enteropathy, for example? If it's a middle-aged or older cat, what's the thyroid gland size? Maybe the clinical signs could be due to hyperthyroidism. That was one of our non-gastrointestinal differential diagnoses. And then, of course, a very careful palpation of abdominal organs. So we're looking for changes in size and shape. We're looking for masses. We're looking for thickening of the loops of the small intestine. We're looking for evidence of foreign bodies. So we want to take our time and do a very careful abdominal palpation. And if the patient is too scared, too stressed, and not cooperating with our physical exam, we might want to use some light sedation so that we can get a very good physical exam done on these patients. So that's a case where we really can't skip all of the components of a physical exam, and we might want to use some sedation to help us facilitate getting that physical exam done in the patients that are not very cooperative. And one area in cats that is sometimes difficult to look at is under the tongue. But you do have to do a good exam under the tongue. And this is one of my patients that had chronic vomiting and ended up having a foreign body, a linear foreign body. Cats are really good at getting linear foreign bodies. So swallowing thread or string or ribbon or dental floss, and it often catches under the tongue. As you can see, that's what the red arrow is pointing to. It's this little bit, you can just glimpse it there under the tongue. And it can sometimes be very, very hard to see. And so you might need some sedation to get a good exam under the tongue. Another trick, and it's a little hard to see in this picture, but I'm using one finger to push up so that I'm actually elevating the base of the tongue in the oral cavity so I can get an even better look underneath the tongue. So you have to be sure, especially in younger cats, that you've done a very thorough physical exam. It's not uncommon for a string foreign body like this one that's quite difficult to see to be missed on a physical exam. So I always have that in the back of my mind, especially for the younger cats, which is where we're more likely to see foreign bodies. So make sure you get a good look under the tongue. So that's our initial approach to history, to physical exam, and the type of assessments that they need. What about initial diagnostics in these patients? So again, these are the chronic vomiting and diarrhea patients. This is where we need a minimum database. And for me, a minimum database in cats means a complete blood count, a serum chemistry panel. It means a full urinalysis. So by that I mean the urine chemistries, specific gravity, and a sediment exam. That's what I mean by a full urinalysis. If your patient is middle-aged or older, I would look at thyroid function, so I would get a total T4. And just as really for almost any set of clinical signs you can mention or think of in cats, we always want to know their current feline leukemia virus and feline immunodeficiency virus status. So I want to know what it is today. Even if this cat was tested a month ago or 6 months ago or a year ago, that doesn't matter. I need to know what is that cat's test results today. So as you can imagine, the serum chemistry panel might give us evidence of things that cause chronic GI signs, like, we might find a patient has chronic kidney disease, and that's why we've got chronic vomiting, or that total T4 might help us. The blood count helps us. Younger patients might have blood loss anemia from parasites. If we've got bacterial infections like Salmonella or Campylobacter, we might have neutrophilia. If we've got a patient with panleukopenia, we might have neutropenia. Those are not usually chronic cases, though. So it's usually more we're looking for evidence of blood loss, anemias, or we're looking for things like neutrophilia on the CBC. So that would be a minimum database that I would want to get done on each of these patients. And of course, for diarrhea patients, we want to make sure we've got a good fecal analysis done. And that means doing it by a centrifugation technique. So there are techniques that don't require a centrifuge. They're usually called gravitational flotation type techniques. There's different systems that you can get for that, but they don't require a centrifuge. The problem is they're not very good. So we get a 6-fold or more improvement, especially in finding parasites that are common, like the roundworms, coccidia, parasites like that. So we improve, especially egg counts, hugely by using a centrifugation technique. So you can either do that in your own clinic, or maybe you'll send it out to a referral lab to do a centrifugation technique. So a lot of parasites that cats get are shed in lower numbers, and these more gravitational techniques where you don't use a centrifuge are not very good when we're looking at parasites or eggs that are shed in low numbers. So we always want to have our fecal analysis done by a centrifugation technique. And for the chronic diarrhea cases too, we always want to make sure we've done a direct smear, because using centrifugation techniques are not the best way to find the protozoa like Giardia and Tritrichomonas. So and the quickest in-clinic approach for that is to do a direct smear. So you always want to do it with abnormal feces. So if today is a day that the cat happens to have a normal stool, that's not the day to do this test. And you want a fresh, warm sample, because you're going to rely on seeing living trophozoites. And if the sample gets cold or it's not fresh, you won't see living trophozoites. So these trophozoites actually live not within the feces itself, but they live in the mucus that's lining the gastrointestinal tract, so they'll be on the surface. So when you take your sample, a small sample about the size of a grain of rice, to put on a microscope slide, you want to take it from the exterior, so you're getting the mucus layer, and you'll put it on a slide, add a drop of warm saline. Remember, we don't want to cool down the specimen, and then put on a cover slip, and then have a look under the microscope. You want a thin smear, so you can see in this example how thin the smear is. You should be able to read print. You should be able to put that microscope slide on top of a printed page and see the letters through the print, through the slide. That's how thin you want the smear. And what you're looking for is moving protozoa, so especially Giardia or Tritrichomonas. So that's one of the quick tests. We're going to talk a little bit more in depth about these protozoa, but that's a quick in-clinic test that you can do. So for all of these diarrhea cases, we always want to have a centrifugation technique, and we want to have a direct smear as well. Okay. Many labs also offer now diarrhea PCR panels that you can get, and these PCR panels, depends on the lab and what they offer to you, but they may offer a wide variety of panels that will give you detection of a number of both bacterial species and viral species, as well as some of the protozoan parasites like Giardia and Tritrichomonas. So because these panels are becoming so widely offered by a number of referral labs, I just wanted to talk about them for a few minutes, because to me there are proper uses for these panels, and there are uses that maybe are not so beneficial to us. So before we go ahead and look at that, let me see if I can send a poll into the room here for you. So here's a poll that I meant to send you earlier and I forgot. Let's do this one first. So do you use a fecal scoring system in your practice? So that's the pictorial one, like the Purina one that I showed you. So let me know if you've got one of those. If you're already using one of those in your practice, that's great. Doesn't have to be the Purina one. It could be any one. And if you don't, well then maybe it's something that you can consider using now, because they are so easy to get and they do give you some nice information. Okay, so we've got most people. I'm just going to end this poll now because I want to ask you another one quickly. So when we looked at this poll, the majority of you said no, you're not using a fecal scoring system. So hopefully that will give you an option to think about indeed going ahead and using that. Okay, so we're going to talk about some of these pathogens, and just as we start to talk about them, I'm going to divide them into a couple of different groups for you. So again, it depends on the lab that you use and what pathogens they can put on a PCR panel for you. But if we look at the bacterial ones, for example, there's actually not a very good positive predictive value if you get a positive result for one of these bacteria. And the reason is that there's a lot of normal, healthy cats walking around that would test positive for these bacteria. So just because you get a positive test result doesn't mean it's the cause of the cat's clinical signs. We're going to talk a little bit more about this in a few minutes. So that's not always a very useful bit of information to get. Coronavirus is often on these panels, but it's not clinically relevant. It's not a cause of chronic vomiting or diarrhea in cats. So I don't care. I don't care what that answer is. And then we do have another group where we actually have individual tests, and you might be better off, depending on your patient, to say, oh, I'm very worried about parvovirus in this acute patient, so I'm going to run a parvovirus test. Or I'm more suspicious of Giardia or Tritrichomonas, and we might be better off just to run the specific tests. Cryptosporidium is another one that there isn't a standardized test for that, so it doesn't always perform as well for us as we would like. So that's one of the reasons it's not always a great idea to run a whole panel. You often get information that's not useful to you. You might be better off to look at that list and say, well, actually, it's really Giardia or Tritrichomonas I need to know about, so maybe what I'll do is I'll just run those tests. Okay, so before we move on and talk specifically about Tritrichomonas, I'm going to ask you, have you ever diagnosed a case of Tritrichomonas in a cat in your practice? I'm kind of interested to see. We do know that this is a pathogen that is present worldwide. It causes mainly large bowel signs in cats, so it looks more like a colitis, but it certainly causes chronic diarrhea in cats, more common in the pedigreed cats. Some surveys have suggested that 25–30% or more of pedigreed cats will have this parasite. They don't all have clinical signs. There are subclinical carriers, but it is a cause of chronic, especially large bowel-like diarrhea in cats, especially pedigreed cats. So as I see the results of the poll come in here, it looks like more than half of you have said yes, I have diagnosed a case of Tritrichomonas in a cat. So we'll move on here. So actually about 2/3 of you said yes, I have diagnosed a case of Tritrichomonas in a cat. So I don't want to spend a whole lot of time talking about this, but I will mention to you that one of the best websites for really everything you need to know about tritrichomonas is Jody Gukin's website, jodygukin.com. Jody is really the person who knows the most about tritrichomonas. She's at North Carolina State. She has a very informative website. It includes a lot of information on diagnosis and treatment. And she has some really good materials there, like videos of what Giardia looks like versus tritrichomonas, so you don't mistake one for the other, for example, on a direct smear. And she has a lot of diagnostic information there, because there are a variety of different tests out there, including PCR, so we'll help you determine what's the best test. Currently, really the only treatment that we have for tritrichomonas is ranitidine. It's not made under license by anybody. It can be hard to get. Some cats are showing up as resistant to ranitidine treatment now, so there is some research going on trying to find an alternative to ranitidine. But it is really at this time the only drug that we have seen that has any efficacy, and the current recommended dose is 30 milligrams per kilo per day for 14 days. Doesn't seem to be a benefit to treating any longer, and higher doses than the 30 milligrams per kilo will risk neurotoxicity, so neurologic adverse signs. So I'll leave you to visit Jody's website for more information. So we've talked a little bit about these panels and how sometimes we might want to focus down on just one or two pathogens, but there might be times when you want to run the whole panel. So for example, if you're trying to find the answer to disease in higher risk cats, these could be immunosuppressed cats, for example, or cats with multiple concurrent diseases. It could be a situation where there's a lot of cats at risk, so a shelter or a breeding cattery. Maybe there's already been a known or suspected outbreak of a pathogen or multiple pathogens, and so you need to do some surveillance. It could be a particularly severe disease that you're having trouble getting a diagnosis, or recurrent disease, diseases, especially diarrhea that's failed to respond to therapies, or if there's ever a concern about zoonotic disease. Maybe this pet with diarrhea is in contact with an immunocompromised person, for example. So there are times when we might use these sort of very broad panels, but we still have to remember that just getting a positive test result, especially for the bacterial components, doesn't guarantee that they're the cause of the disease. So that brings us to fecal cultures. And there are some times when I will do fecal cultures. I'll do them if the cat has bloody diarrhea. So especially acute bloody diarrhea, that's an indication. And often these cats have systemic illness, so they have fever, they have leukocytosis, they're dehydrated. They might look a lot like a panleukopenia kitten, for example. So that type of presentation makes me think of bacterial enteritis. And so that might be a reason why I would do a fecal culture, looking maybe for something like salmonella, for example. And these are often cats that are living in very dense populations, stressful housing, or where there's been exposure to maybe a food source that's gotten contaminated, or raw diets. So those would be situations that would prompt me to do a fecal culture. Otherwise, we don't really get useful information from fecal cultures in cats, because of course you can culture all kinds of bacteria from normal cats. So those are the situations where I tend to reserve fecal cultures in cats. So those are sort of the first line diagnostics that we want to do on all cats. So let's talk now a little bit about those advanced diagnostics that we might start looking at in certain cases, because by now we're refining that differential diagnosis list. It should be getting smaller, so we should be able to do more targeted diagnostics now when we come to this advanced group. So we're going to talk a little bit about radiographs and ultrasound, so imaging, and how that might lead us to doing biopsies in some cases. And we'll also talk a little bit about gastrointestinal function testing as well. Okay. Before we talk about each of these, though, I want to tell you about two rules, or two, let's say, guidelines that I think are very useful when you're starting to pick tests, especially once you're starting to pick more advanced tests that are costly, or that you might have to refer a patient elsewhere to get these tests done. So I think the two rules we should always keep in mind are, number one, only perform a test if you're pretty sure the outcome is going to change your case management. If the answer, one way or the other, will not change the management of the case. And that could be for many reasons. It could be, maybe you'll diagnose something that you already know the owner can't afford to treat or won't be able to treat for some reason. That could be an example. So if the outcome is not going to matter, we would want to think twice about performing that type of test. And the other situation is, or the other rule I would say is, when you have a group of tests that you could choose from, the one you pick first is the one that's most likely to give you a diagnosis. So there might be 3 or 4 different things we could do, but we want to prioritize them and at least make an educated guess at which one is most likely to give us a diagnosis and do that one first. So I always try to keep those rules in mind. I don't want to waste the owner's time or the owner's money, and I want to try to be as focused as I can in my diagnostics. So let's talk a little bit about imaging first. When we do survey radiographs on these patients, I always do 3 views. So 2 lateral views, right lateral and left lateral, as well as either a dorsoventral or a ventrodorsal. And the reason I want 3 views is sometimes there's a gas focus in there, and redistribution of pockets of gas might actually give you a different view. It acts a little bit like negative contrast, and so you might see something, for example, on a right lateral view that you don't see on a left lateral view. So when we do those survey radiographs, we always want to use 3 views. And typically we're looking for things like foreign bodies, effusions. We'll look at a couple of cases in a minute. We might also want to try compression. So that's gentle compression over the abdominal organs. Often it's done with something wooden, a wooden paddle or a wooden spoon, for example, to isolate the small intestine so you don't have other abdominal organs on top of it obscuring the view. So gentle pressure, we would only do that if there's no abdominal pain. So if your patient has severe abdominal pain, we would never want to do a compression radiograph. But it can be useful to do that on a lateral view to isolate the small intestine. And then there are times when we might do contrast radiography, and it's a good rule of thumb to use water-soluble agents in cats. It's a little bit more time-consuming. You have to take multiple views when we do contrast, but sometimes we can, some foreign bodies, it's the only way you'll find them is with contrast. So we want a water-soluble, non-ionic agent. Like iohexol would be a good example in cats. That would be the type of contrast agent that we would use. So typically we're looking for foreign bodies or localized areas of distension. We're looking for bunching or plication, pockets of free gas or fluid, or maybe there's what they call a ground glass appearance to the abdomen, which would make us think that there is a peritonitis involved. And again, foreign bodies don't always show up on survey radiographs, so that's why sometimes we might need to either do contrast radiographs, or we might need to move on to something else like endoscopy, for example. So we have to remember that normal findings don't necessarily rule things out, especially foreign bodies. So just a couple of examples. So this is a cat, a chronic vomiting cat that had actually swallowed a button that had a metal center to it. So it showed up very, very nicely on the radiograph. But we also see a lot of linear foreign bodies in cats. So this is an example of a chronic vomiting patient with a linear foreign body, and the red arrow there, the red arrow is pointing to an area. It's a little bit hard to see because the radiograph is small, but this area of the cat's bowels, the small intestine, is very bunched. It's all bunched up. And so that's a hallmark of a foreign body. And indeed here, this cat had swallowed a piece of ribbon. So that might be one of the things that would lead us to suspect a linear foreign body in a cat, for example. So I did mention contrast. That might help you find things like foreign bodies, but sometimes it also gives us some surprising findings. This was a cat with a chronic vomiting that turned out to have a hiatal hernia. So it wasn't until we did contrast that you can see here's the contrast on the wrong side of the diaphragm. So this cat actually had the distal esophagus and the stomach in the thoracic cavity. It was protruding through a hiatal hernia. And that's the type of thing that you're you're not going to find without a contrast radiograph. Those can be congenital. They can also be acquired. These cats tend to have chronic intermittent vomiting, sometimes with regurgitation, but often it's just chronic intermittent vomiting. And here's the ventrodorsal view on the same patient. So there are times when contrast radiographs give us that much more information. We have to remember that ultrasonography, although it's also imaging, gives us additional information. And I never like to think of, I'm going to choose one or the other, radiographs versus ultrasound, because they give us different types of information. And in some patients, we might do both. We might start with radiographs, often because they're cheaper and easier, but we might also need to do ultrasonography. So they're not either or. They give us different types of information. So ultrasonography is often good at giving you information on the nature of the problem. So it can help it evaluate the layers of the intestinal wall or the stomach. So is the thickness or the architecture normal? It can tell us if lymph nodes are involved, for example. Are other abdominal organs involved? That type of information. And it can localize the problem. So is more than one organ involved, or is it targeted? Is it just focal to one organ? Particularly for the gastrointestinal tract, it might let us know if the next best step, which is often a biopsy, should we do that by endoscopy, in which case we can only reach the proximal gastrointestinal tract? So does ultrasound tell us the lesions are there? Or is it more distal, in which case endoscopy for the small intestinal tract is not going to be very useful because we have difficulty getting to the distal small intestinal tract. So sometimes it can help tell you what will be the next step. So we don't always get a specific diagnosis from ultrasound, but often we get information that advances the case and tells us the next best step. We do sometimes get a definitive diagnosis. A foreign body, for example, we find some of those by ultrasound, or intussusception. I'll show you some examples in a moment. But more often than not, it's going to tell us the next step. So it might say, okay, you need a biopsy or you need endoscopy. And again, just like radiographs, we have to remember that a normal abdominal scan does not rule out diseases. So, for example, cats can have intestinal disease, especially things like inflammatory bowel disease or lymphoma, and have a normal abdominal scan. I'm going to tell you a little bit more about that in just a minute. But first, let's just look at a couple of cases. So this was a chronic vomiting cat, and when we did abdominal ultrasound on her, this is the lumen of her stomach, and this is the thickness of her stomach wall. So there's a massively thickened stomach wall, and so we typically would see that in cases of neoplasia, for example. So that might not give us the diagnosis, but it certainly narrows our differential diagnosis list down, and it's going to tell us what the next step is to get a specific diagnosis for that patient. In the small intestine, again, we're going to be looking at how thick is the small intestinal wall, and are there changes in the architecture, so we can actually look at these layers in the small intestinal wall. And here we're using the calipers to measure the thickness, and in this patient, in the duodenum, the average thickness was somewhere between 0.32 and 0.38 centimeters, and it should be less than 0.28. So that tells us this cat has a thickened, and it's usually mucosa, and it's going to benefit from a biopsy. So again, it might not tell us exactly what that cat has. That cat could have lymphoma, it could have inflammatory bowel disease, it could have some other disease, but it does tell us what the next step is for that cat. And sometimes it gives us a little bit more specific information to order our differential diagnoses. You know, again, another example of a cat with a very thickened proximal duodenum. So here with the calipers we're measuring, and look how thick, 0.61. That should be well under 0.3 to be normal in the duodenum. So a massively thickened duodenum in that cat. Again, this was a chronic vomiting patient, so that tells us this patient now needs a biopsy to get a definitive diagnosis. So that's the type of information. Sometimes foreign bodies, so with foreign bodies often what you'll see is these areas of distension in the lumen of the bowel. So these distended areas tell us that there's an obstruction, and when this cat went to surgery, there you can see the obstruction, and then proximal to the obstruction are these distended areas of the bowel. So we know that now that cat needs to go to surgery. Same with intussusception. So we get a very specific appearance on ultrasound with these concentric circles of alternating layers of echogenicity. And here we are at surgery. You can see there's the section of intussusception right there that this cat ended up having a resection. So sometimes it does give you a specific diagnosis, but if nothing else, it might help you know the next step. So some of these patients will need to go to surgery, the foreign bodies, the intussusceptions, any evidence of obstruction, if they have projectile vomiting, if we have evidence of a perforating ulcer. And then sometimes it's just for diagnostic purposes. So it might be through endoscopy or it might be through laparotomy, but we'll need a biopsy for diagnostic purposes. So sometimes that's where we need to end up. So we've been using imaging to try to rule in or rule out and cut down that differential diagnosis list. I want to talk a little bit more about 3 common gastrointestinal diseases that we'll see in cats that often what will happen when we go through our initial diagnostics and our imaging, we don't get a diagnosis. So these patients often have normal abdominal scans. They often have normal radiographs. They might even have normal blood work. And so then I start to think about diseases like inflammatory bowel disease or the food-responsive enteropathies or lymphoma, especially small cell lymphoma in cats. So, you know, when a lot of our tests start coming back as normal or negative, this is where my mind starts going in these cats with chronic vomiting and diarrhea. And these are very hard to distinguish one from another. I put this table in your lecture notes, so I'm not going to spend much time on it right now, but it tells you the features of these 3 different categories that might help you for a given patient decide which might be more or less likely on your differential diagnosis for, you know, for a specific patient. So I'll let you look at that in your set of lists, your set of lecture materials. What I do want to talk about is one of the ways to help us without going to biopsy, because obviously in inflammatory bowel disease and lymphoma are biopsy-based. So what can we do before that step? That's where gastrointestinal function testing comes into play. And again, it depends on the laboratory that you work with, but they might bundle together a panel of tests that usually include cobalamin, folate, feline PLI, so pancreatic lipase immunoreactivity, and then the TLI, the trypsin-like immunoreactivity. And so we're going to talk a little bit more specifically about cobalamin in a moment. But typically we would see that decreased in cats that have small intestinal disease. We might see that decreased in lymphomas or inflammatory bowel disease or even exocrine pancreatic insufficiency. Folate levels tend to be decreased with proximal small intestinal disease. The PLI can help us determine if our patient's clinical signs are due to pancreatitis, and the TLI is really our test of choice for the chronic diarrhea cats who have exocrine pancreatic insufficiency. So we might order that as a panel, or we might look at only one or the other. And typically if I'm just picking one instead of the panel, it will be cobalamin that I'll pick. So I do want to talk a little bit more in depth about cobalamin. But before I do that, I'm going to send a poll in, and I'm going to ask you, are you able to get serum cobalamin samples tested in your lab? So do you have a referral lab that will allow you to do that? In just a moment, I'm going to tell you why I think it's really useful to look at serum cobalamin levels in cats with chronic gastrointestinal signs. So I use it as part of my diagnostic workup in these cats because as long as you have a lab that'll do it, it's easy to do. The cobalamin test by itself does not require fasting. If you do that whole panel, you usually do have to fast your patient. But if you're just doing cobalamin alone, it doesn't require fasting. So it's an easy test to do, and it can give us some really useful information on our patients. So as your results are coming in here, it looks like most of you, at least 80% of you, are saying yes, I can get serum cobalamin levels done. Okay, so that's good to know. So here's why I think it's a good idea to look at serum cobalamin. And I'm going to base it on this study that was published in the Journal of Feline Medicine and Surgery. So this study came out, I think, a year or two ago. Really nice study from Texas A&M where they looked at serum cobalamin levels in cats that also had ultrasounds done and they also had biopsies done. So they had 75 cats with chronic gastrointestinal signs, vomiting and diarrhea, and these 75 cats all had serum cobalamin levels done. They all had abdominal ultrasound done, and they all had a biopsy diagnosis. So it's really interesting information. So when we look at that group of cats, there's the 75 cats, and they all had serum cobalamin levels that were below 500. Now, different labs have different reference ranges and even different units of measurement for cobalamin. So you have to look at what your lab's range is. But for this lab, the normal reference range is 290 to 1500. So they picked cats that were all below 500. So they were all low normal or below normal. So some of them would have been under 290, others would have been between 290. So let's say 53 of them, as it turns out, 53 of these cats were below about 300, so they were subnormal, and 22 of them were normal, but in the low normal range. And so they looked at what the diagnoses were for these cats. Of that 53 cats that had subnormal serum cobalamin, 47 of them had gastrointestinal disease, and they were about evenly split between IBD and lymphoma. There are some other things that will cause low serum cobalamin, particularly any disease that causes polyuria and polydipsia because it's a water-soluble vitamin. So cats with polyuria and polydipsia also might have low cobalamin. But as you can see, it's a strong indicator or predictor of small intestinal disease. So sometimes I'll look at that serum cobalamin level, and if it's low, I'll say to the owner, boy, the likelihood is high that your cat has small intestinal disease, especially based on the other tests we've done, and we need a biopsy. But what about these 22 cats that had a normal cobalamin, but it was low normal? Interestingly enough, when we looked at those cats, 13 of those cats, so more than half of those cats also had gastrointestinal disease. 8 of them had inflammatory bowel disease and 5 had lymphoma. So even a low normal cobalamin level might be an indicator that your patient has small intestinal disease. So that's a non-invasive way of advancing the diagnostics on a case, and that can help you explain to the owner why we need to get a biopsy as the next step. So interestingly enough, as I said, these cats all had ultrasounds, but a quarter of those cats that had confirmed small intestinal disease had a normal ultrasound. So that's why I say, or why I said earlier, that a normal ultrasound does not rule out especially small intestinal disease in the cat. And these authors at Texas A&M said you can't exclude gastrointestinal disease just because the cobalamin is in the low normal range and the ultrasound exam is normal. There were no abnormal findings. We still have to keep especially small gastrointestinal disease on our radar. Okay, so that's the suite of diagnostics. So we'll just talk a little bit about therapeutics. There's too many diseases to talk about specific therapeutics, but I did want to talk a little bit generally. So we're going to talk a little bit about antiemetics and probiotics. We'll spend a minute or two on dietary therapy. Of course, there's a lot of specifics. We will talk a little bit about antibiotics. The rest, I'll leave to you because you can look up specific treatments, corticosteroid protocols for IBD, for example, and specific treatments like fenbendazole for giardia or the ranitazole that we already talked about. So we'll just talk about some of these more generic ones that we might use in a number of different types of cases. So I just wanted to do a quick review of the antiemetics. In the webinar that I did for you, if you watched the one on chronic kidney disease, we talked a little bit about antiemetics. So just as a review, meropitant would be our first-line antiemetic in cats. It is very effective for most of the causes of vomiting, whether it's acute or chronic, that we see in cats, and we talked about using it for chronic kidney disease. Injections can sting, so we often, or we typically keep the bottle in the refrigerator. It seems to sting a little bit less if it's cold. Another potential drug is mirtazapine. Works through a different mechanism, and it's also an appetite stimulant. So that's a drug that we might pick for some of our patients as well. So those are two quite valuable drugs that we can use. One of the older drugs would be ones that fall under the phenothiazine class. These are drugs we don't tend to use as much anymore. An example of that class of drugs would be prochlorperazine. One brand name is Stemetil, for example. And one of the reasons we don't use these drugs as much anymore is they do tend to come with sedation. We should avoid them in patients that are already lethargic or depressed or dehydrated, so they're much more limited. And metoclopramide is also limited in the cat. It's not as good an antiemetic in the cat as it is in the dog. It's actually a pretty weak antiemetic in the cat, so I don't use it any longer as an antiemetic, and you have to be very sure that your patient does not have an intestinal obstruction because this is a prokinetic agent. So we really do like to stick to meropitant and then maybe mirtazapine. Another potential drug is ondansetron. But it must be given every 6 to 8 hours. That's fairly new information. Some of the older formularies will mention giving it twice a day. Turns out that's not enough. We also probably need to be at the high end of the published doses, around 1 milligram per kilo, every 6 to 8 hours. So meropitant is just more convenient to give, and it's got a very proven track record. I did want to mention that the H2 blockers, drugs like famotidine or ranitidine, are not antiemetics. And as a matter of fact, they are falling out of favor in feline medicine in general. So I often see veterinarians using these drugs in the mistaken belief that they are somehow useful for the vomiting patient, but they aren't. So they are drugs that I definitely would not reach for. So when we talk about the antimicrobials, the two generic ones that we might use would be metronidazole or tylosin. And we use these not so much because they kill a specific pathogen. Sometimes we use them for that, but more often it's their immunomodulatory properties and their ability to influence the microflora. So we sometimes use these in our chronic diarrhea cases as an adjunct therapy for inflammatory bowel disease, for example. And again, it's not so much because we're targeting a specific bacteria, but usually more for their immunomodulatory capability. So I've put the current recommended doses. So for short term, for the acute vomiting patient, we might use them 5 to 7 days. Metronidazole, we might use longer term as an adjunct therapy, for example, inflammatory bowel disease. What about other antibiotics? Well, when we're talking about GI cases, especially diarrhea cases, there's not a big role for antibiotics. So we would reserve them for patients with systemic illness. So patients with fever, leukocytosis, for example, or an immunocompromised patient. You might use them when we have confirmed that the cause of clinical signs is an infection like Campylobacter, for example. The one instance where we don't use antibiotics, even in the face of a confirmed infection, is Salmonella. So we do have some data that suggests that using antibiotics in a confirmed Salmonella case actually prolongs recovery. So although it sounds a bit counterintuitive, standard of care for a long time for most Salmonella cases has been supportive care rather than a specific antibiotic. So we do have some really limited uses. And because we want to be cognizant of proper use of antimicrobials to avoid our increasing problems with resistance, to me you have to have a very good reason to give an antibiotic other than maybe metronidazole or tylosin to a chronic, especially a chronic diarrhea patient. You have to have a really good reason, in my book, to use antibiotics in those patients. So if you want to read more about this, the American College of Veterinary Internal Medicine has a really nice free set of guidelines on treating enteropathogenic bacteria in dogs and cats. So the ins and outs, which diseases, when do we use antibiotics, how do we make diagnoses, what are the other treatment and control options, and so on. So I'd refer you to that document, which you can find free online. So that's antibiotics. I just wanted to say a word or two about probiotics. We are interested in probiotics because they have a lot of interesting properties, like being anti-inflammatory, maybe a bit immunoregulatory, the same way we think of metronidazole, for example. They might help exclude pathogenic bacteria through competition. They might inhibit bacteria from translocating across an inflamed or a diseased gut wall. So at least on paper, there certainly is a lot of potential benefits to probiotics. There are a number of cases where we might think about using them. So I'm going to send the last poll that I have for you before we move ahead talking about probiotics, and just ask you, do you routinely use them in your chronic diarrhea cases? So is there a product, for example, that you would reach for, no matter what the underlying disease is, that you might use as adjunct therapy in your chronic diarrhea cases? So boy, so far we've got 100% yes. So you're all very quickly saying yes, I do routinely use probiotics in my cases. Okay, well that was a very quick and resounding response. Okay, so let's just talk a little bit more about probiotics. I do recommend that you have a little bit of caution in thinking about probiotics, partly because not all products are created equal. And there are a couple of studies in the literature looking at some of the various probiotics on the market, and because they are usually unregulated, they're not regulated like a prescription drug, you're not guaranteed that they contain what they say they contain, or that they even contain anything useful. So if there's a rule of thumb I would say to you is, whenever possible, use a probiotic that's made by a nutrition company. So, or a company that has a very good track record with their other products. So I tend to use the probiotics that are made by, like Purina, for example, makes probiotics, or we have a company in North America, Nutramax, that makes probiotics. So I would stick with really well-known companies, especially a nutrition company and a company with a good track record, because there is virtually, in most markets, little or no regulation of these products. So you have to, it's buyer beware, you have to be careful. In cats, there's only 2 studies that looked at probiotics, so we actually don't have a lot of data in cats. And I'll just quickly show you them. One was done with Fortiflora, the product that's made by Purina, done in Colorado in shelter cats, where they see a lot of diarrhea in shelters. These cats have diarrhea for a lot of different reasons: parasites, just stress, infectious diseases. So they looked at giving Fortiflora to 2 groups of cats in this shelter. So one group of cats got a placebo, and one group of cats got Fortiflora as the probiotic. And they discovered that it did cut down the number of cats that had diarrhea for more than 2 days after entering the shelter. So the cats that were on placebo, 21% of those cats had diarrhea for more than 2 days in the shelter. But of the cats that were on the probiotic, only 7% of those cats had diarrhea that extended for more than 2 days. So they did see a definite improvement in the cats that were on Fortiflora. And again, these cats would have had diarrhea for all kinds of different reasons. The other study was done in adult cats with chronic diarrhea. These were all older cats, and they ruled out common diseases in these adult cats, like diseases like hyperthyroidism, any obvious diseases they ruled out. They ruled out parasites as well in these cats. So these cats probably had a variety of other diseases. Some might have had inflammatory bowel disease. Some might have had food responsive diarrhea. Could have been anything like that. And they were on ProViable, which is a Nutramax product, for 21 days, and they had the owners assess the response. On that fecal score chart that I showed you earlier, the fecal score improved. So the average score was 6 at the start of the study, and it didn't go to normal, but it improved, and at least 3/4 of the owners saw some benefit. So it's not the most robust study that's in the literature, but at least it did give us some evidence. So I think there is a place for probiotics, but I just caution you to use a reputable product. There's also a number of types of diets that we can use for these cats that are either have inflammatory bowel disease or have food responsive disease. And I guess because there's so many different types on the market, whether it's a novel protein source or a hydrolyzed protein source, the only thing I would say to you is that you probably can't have just one diet to work for all of these different types of cases. And so we may have to do diet trials in these patients, because some will do better on a novel protein source. Some will do better on a hydrolyzed protein source. So you might have to try more than one diet. The good news is it usually only takes about 2 weeks to know if a diet trial is working. If it's skin disease, we tend to need a much longer diet trial, but if it's gastrointestinal disease, usually we'll see a response, if there's going to be one, within 2 weeks. So if we don't have a good response within 2 weeks of feeding a diet trial, we can move on and we can try another diet. So we do have quite a bit on the market, and there is some evidence specifically for IBD, a couple of published studies that say sometimes it can be the sole treatment for cats with IBD. We might not even need corticosteroids in some of our IBD patients if we find a diet that works very well for them. So I always work hard at finding a dietary approach to especially the IBD cats. Some will need corticosteroids, but they don't all. So I guess the take-home message there would be don't be afraid to try more than one diet, and you only need a 2-week trial, whether it's a food responsive or an IBD or something like that, colitis, some disease like that. Okay, so in summary, it's a big potential set of differential diagnoses for our chronic GI patients. So we do need a good medical history. We do need a good diet history. Remember to get more information in your diarrhea patients by using pictures and fecal scoring. Remember to be thoughtful about your approach and systematic. So use both that problem solving and that pattern recognition approach, so you always have a complete list of differentials. You refine them based on your patient, but you don't forget anything because you're using that combination approach. And remember those 2 rules that I mentioned to you, especially about advanced diagnostics. Only perform a test if the outcome will change your case management, and the first test you pick should be the one that's most likely to give you a diagnosis. So I think if we keep these general rules of thumb in mind, it will help us be methodical and hopefully efficient at using the client's time and money in coming to a diagnosis as best we can for these patients. So as always, I want to thank some of my colleagues who shared images with me, especially the ultrasound and radiography images. Some of them came from some of my colleagues, so I thank them. And I always like to show you my contact information again at the end, especially since this is my last webinar with you. So